Hi everyone, welcome back to my channel. Nurse Katherine here. Welcome back to another Saturday video. In today's video, I am going to be talking about the differences of inpatient nursing versus outpatient nursing and some common myths about both of them. Before we get this video started, do not forget to subscribe to my channel and give this video a big thumbs up to help get this video out there for other viewers just like you. Alright, so let's get this video started. Okay, so first let's start with the three myths of inpatient versus outpatient nursing. Myth number one is that inpatient nurses make more money. Not always true. Myth number two, outpatient nursing is slow and paper pushing. Not always true. And number three, once in outpatient nursing, you can't get back into inpatient nursing. Those are all false. I say these are all myths because I personally know they are. Number one, of inpatient nurses make more. I make the same money right now in outpatient nursing as I made as an ER nurse at a very, very well-known hospital up in Pennsylvania. And I make the same money down here in Georgia. So that is totally false, and I am debunking that right now. Number two, of outpatient nursing is slow and paper pushing. Totally false. I'm in outpatient nursing right now and it is not paper pushing at all. I hardly actually have to do any paperwork. I have a lot less charting to do than what I had in inpatient nursing, and it is not slow. There will be some slower days just like inpatient nursing, but I am busy throughout the entire day. And number three myth that I am debunking is that once in outpatient nursing, you are stuck. And that is not true because I am constantly having travel nurse agencies reach out to me to offer me jobs all over the nation. So just because I'm in outpatient now does not mean I can't go back into inpatient nursing. Okay, so now that I have debunked those myths, let's actually talk about the differences of inpatient nursing versus outpatient nursing. I'm focusing on three topics, and those are work environment, types of patients, and the pay. Okay, let's start with work environment. On the inpatient side, that is a 24/7 round-the-clock job. You need day shift, night shift, mid shift, whatever that hospital wants. Now, when you go to the outpatient setting, those are set hours typically, maybe a 9 to 5, maybe a 6 to 4, whatever it may be. So inpatient nursing is 24/7 kind of work environment, and outpatient nursing is more set hours. Now, your working environment kind of can be the same if you are in outpatient as it was in inpatient. So like the facility that I work at, I'm in an outpatient clinic, but it is attached to a hospital. So I'm still driving to the hospital area, parking where all the other hospital employees work, but I'm in a clinic setting. Or like an infusion center. Some infusion centers are actually in the hospital and just on a lower floor or upper floor, just depending how that hospital is set up. So you still can be in the work environment of a hospital just as a clinic. Which leads me on to my second topic, and that is the types of patients that you will encounter. So for inpatient nursing, the types of patients you encounter are acutely ill patients. So the acute care setting, which also is another name for inpatient nursing. So the acute care setting, you are taking care of patients who are acutely sick and acutely ill. Then for the outpatient setting, you're taking care of patients with these chronic diseases that necessarily aren't acutely sick, although that can change a little bit. So let me expand on that. In the area that I am working in a transplant clinic, these patients that I am seeing can be acutely ill. They can be having rejection. So their organs, their donated organs are rejecting, their body's rejecting that organ. So they actually are acutely ill, but not acutely ill enough to have to be hospitalized. We can treat them in the outpatient setting, give them the IV medications that they need so they do not have to go into the hospital. When working in acute care, you really are focusing on what the acute problem is, not the holistic view on the patient. Typically, I will say typically because it is not like that in every single area that you go into, but normally you're just focusing on that cellulitis that brought that patient in, or the heart attack that's bringing the patient in, like if you're in the ER. But on the outpatient setting, you are looking at this patient in more of a broader view. So these patients are coming in, you're doing a lot of broad education as well as focused education, but it is more holistic care. At least that's what I have seen with working inpatient versus outpatient. I also have found that I have more time to spend educating my patients in the outpatient setting versus the inpatient setting. And that is because I was coming from the emergency room. So in the emergency room, of course, it's very fast paced and you're constantly running all around. In the outpatient setting, comparing it to the ER, of course, that is totally different. I have more time to spend with my patients, spend talking with my patients and getting to know my patients because I will see them every single month, most of them. So I have a lot more time to sit with them and talk about their care as a whole and just to educate them as a whole, rather than in that acute setting, which this is where the big difference comes in, where you're just educating on that acute illness. All right, and the last topic I want to talk about is the pay. The pay of inpatient nursing versus outpatient nursing. And this is huge, and a lot of people think inpatient nurses always make more versus outpatient nurses, and that is not true. There are differences, and this is why I think people think that inpatient nurses make more money. So in inpatient nursing, like I said, there is the 24/7 care. So you have your day shift and your night shift, and night shift normally makes more, of my experience, always made more money than your day shift. So you are in a constant need for someone to be there versus outpatient, where there are set hours like I talked about. So for outpatient, there really is not a lot of room to get overtime. On top of picking up overtime, there is no extra area to pick up more shifts because typically you're working 4 or 5 days a week rather than 3 days a week like a lot of inpatient nurses are working. So you're not working those 3 12s and say, hey, I want to pick up 2 more shifts and work 5 12s in a week. It's your hours are already set, so there's not room to expand and get overtime like there is on inpatient nursing. All right, so that is it for this video. Those are the biggest differences that I have seen for inpatient versus outpatient nursing now that I have experienced both of them. If you liked this video, please give it a big thumbs up and do not forget to subscribe to my channel. But other than that, I will see you in the next video coming out next week. All right, everyone, have a wonderful weekend.